Welcome to the Brown Bag Lunch Training Series for Family Voices of California, a training series on health and policy topics affecting children and youth with special health care needs. All of our presentations are geared towards families, professionals, parent-to-parent staff, youth, and anyone else who's interested. Today's topic is the Medicaid Waiver Program, a primer, with Randy, Layla, and Suzanne Butler from the Orange County Regional Center. A few notes before we proceed about the technology. Unless you're absolutely sure that you have a headset with a microphone that allows you to speak through your computer, you'll need to call in or type in with your questions. You can find the call-in number from your confirmation email, or while you're connected, you can go to the audio menu, select Use Telephone, and it will provide you with a dial-in, access, and audio pin. Remember to enter the audio pin. And if you have any technical difficulties, you can call GoToWebinar or send me, Tara Robinson, a chat or a question. And owing to feedback issues, we generally have everyone on mute from our end. So when you'd like to ask a question, you select the hand icon located on the control panel. We will provide the opportunity for you to ask questions, I think at 2 points during today's presentation. So jot them down as they occur to you. And we will also email everyone a link for the video of today's presentation and the PowerPoint slides. It's one question we always get. So with that, I'm going to go ahead and turn it over to Randy and Suzanne. Welcome, and thank you so much.
Hello.
Hello.
My name is Randy Laya. I'm the Federal Programs Manager at the Regional Center of Orange County.
And I'm Suzanne Butler. I am the Insurance and Benefits Specialist for the Regional Center also.
And we're going to be talking about the Medicaid Waiver Program. So what is the Home and Community-Based Services Waivers? There are a number of them in the state of California. The Medi-Cal waivers, as they're known, they're called, are programs under Medi-Cal that do a number of things. They provide additional services to specific groups of individuals. They limit services to specific geographic areas of the state, and they provide medical coverage to individuals who may not otherwise be eligible under the Medicaid rules. And just as an aside, Medicaid is the federal benefit for people on welfare. So that's for the whole country. The state of California has renamed that Medi-Cal. So Medi-Cal and Medicaid are the same thing. It's Medicaid everywhere else in the country, but here in California we call it Medi-Cal. Currently there are 10 waiver programs in California, and we'll just show you a few of them. A few of the home and community-based services waiver programs currently authorized in California are these. And I just want to say what the home and community-based services Medi-Cal waiver is. And the reason why it's called home and community-based services waiver. A number of years ago, the only way for an individual who needed specialized services was to go to an institution, a hospital, a state hospital, a developmental center, a psychiatric ward, a psychiatric hospital, and if they were there, they would get all the services that they needed. There was a time a number of years ago, I believe it was under Ronald Reagan, I can't be sure, but I think that's when this started. A number of families didn't want to put their loved ones in institutions, but they still had needs that needed to be met. So that's why it's called the Home and Community-Based Services Waiver. So there's some there are some things that are being waived. In other words, living in an institution, and we're still able to provide services. The Home and Community-Based Services Waiver for individuals with developmental disabilities is also known as the Medicaid Waiver or the DDS Waiver. And DDS stands for the Department of Developmental Services. And that's the state agency that oversees the 21 regional centers in California. There are other waivers, and one is called the In-Home Operations Waiver, or the IHO waiver. And under those, under the In-Home Operations Department, there's the Nursing Facility Acute Hospital waiver, and those are for people whose level of care is very high, meaning they need a lot of services.
ICF to subacute.
It's subacute.
ICF to subacute.
ICF to subacute. Okay, that's right. They have and we'll cover the level of care in a moment. And then we also have the in-home operations waiver. There's also, just so you know, a multi-purpose senior services program waiver, and there's an acquired immune deficiency syndrome and AIDS waiver. And again, the purpose of all of these waivers is to keep people in their community and not put them in an institution or a hospital. For those of you that don't know the role and responsibility of the regional centers, there's 21 regional centers, as I mentioned, and our duty, we're charged with the responsibility to coordinate, provide, and arrange or purchase services and supports for persons with developmental disabilities in California. The regional center does not we don't give services. We purchase services from vendors who then deliver the services to individuals. So we purchase services for individuals with needs. The regional centers were created under the Lanterman Act and received their funding through a contract with DDS, the Department of Developmental Services. And DDS has delegated responsibility to the regional centers for assuring that the home and community-based services waiver requirements are met. So what does the Medicaid waiver do? The Medicaid waiver in California allows California to claim Medi-Cal reimbursement for specific regional center services. So some of the services that we purchase, we can claim federal money for some reimbursement, not the whole entire bill, but up to 50% reimbursement. So if we're paying for a certain service, if somebody's on the Medicaid waiver, 50% of that can be claimed to the federal government. And the second bullet, regional centers must meet consumers' needs. It is our duty both to identify needs and then to meet those needs. So, like I talked about, the federal funding and the 50%, up to 50% federal funding, the major and the big purpose of the Medicaid waiver program is to bring federal dollars to the state of California. So what are the Medicaid Waiver Program requirements. How does a child or a person with a developmental disability qualify for the Medicaid Waiver Program? Number one, they must meet the Lanterman Act definition of a developmental disability. And you can see that we've listed them. A disability which begins before age 18. It's expected to continue indefinitely, presents a substantial disability for the individual, and is due to one of five things: mental retardation, cerebral palsy, epilepsy or autism, or a condition that requires the same types of services that a person with mental retardation would require. And the caveat down at the bottom, the definition expressly excludes other handicapping conditions that are solely learning disabilities, psychiatric disorders, or physical in nature. So you need to have a developmental disability. Number two, you need to be an active regional center consumer. Regional centers administer three different programs: prevention, early intervention, and what we call ongoing or active case. And each of them have their own eligibility criteria. So in order to be on the Medicaid waiver, a regional center needs to determine that you are eligible, or that a person has a developmental disability and is eligible for regional center services. The third requirement of the Medicaid waiver program is that a person needs to have full scope Medi-Cal benefits. In order to be eligible or to access all services available through Medi-Cal, or meet the requirements for institutional deeming, which we'll talk about in a minute. But the main reason, or the reason why a person needs to have full scope Medi-Cal benefits is, again, in the second or third slide. I talked about the main purpose of the Medicaid waiver program is funding, and it's to access federal funding, and that's done through Medi-Cal. So one of the requirements to be on the Medicaid waiver program is for the person to have Medi-Cal, because if they don't have Medi-Cal, then the regional center can't bill Medi-Cal, and we can't bill the federal government. So again, it's about funding. The fourth qualification is a person needs to have substantial limitations in adaptive functioning. Basically, this gets to a level of care determination. And the regional center has a level of care determination evaluation form. You see ICF-DD, which means Intermediate Care Facility for the Developmentally Disabled. And the H is for Rehabilitation, and the N is for Nursing. And the N is for those people who need additional nursing hours. So no matter how old the individual is, they still need to meet this level of care. So they need to be eligible to live in an ICF. And once again at the bottom, this determination is typically made through two CEDAR deficits, which is a client developmental and evaluation report deficit. It's 2 or more.
Medical.
Oh, so they have to have 2 CEDAR deficits or medical deficits that meet the federal eligibility requirements. The 5th qualification is they cannot be concurrently enrolled in another HCBS waiver. Individuals, we have some individuals that may occasionally qualify for 2 or more waiver programs, such as what I talked about before, the NF, the nursing facility for acute hospital waiver, for medical technology dependency, and the Medicaid waiver. So they may qualify for both. They can only be enrolled in one, and the reason why is because we cannot bill the state and the federal government 2 times. So you can only be on one waiver at a time. The 6th qualification is a family, a consumer, or their family or their representative must choose to participate and receive services through the HCBS waiver and to reside in the community setting. This is because the federal government doesn't want states to put people on the waiver just so they can access federal funding. This is a choice-based program. So people make a choice to live where they want to live, if it's in the community or at home, or parents make a choice, I want to keep my child in my home, and that's a choice to be on the Medicaid waiver program. One important requirement is that individuals on the Medicaid waiver must use a qualifying service at least one time every 12 months. And again, that gets to the funding. If somebody is not using a qualifying service, that says a couple different things. Number one, if they're not using a service, that shows the government that the regional center is not meeting an identified need. Because the only way the government knows that we're meeting a need is to pay for a service. And the other reason why, so this is another reason, excuse me. To remain eligible for the Medicaid waiver, a family or a consumer needs to use a service, and it needs to be billed to the regional center one time every 12 months. And you'll see the $1,000 per month. That's kind of a guideline. Again, this is a program that's mainly based on about funding. So for us to put somebody on the waiver below, if they're using only $1,000 a month, that's not a lot of money for the regional center. And for us to provide Medicaid waiver services and all the things that are involved, they kind of use the $1,000 guideline per month. Services that qualify for the DDS waiver program are these, and you can read them. They're listed there. Just a few: home health aid services, respite care, habilitation, environmental accessibility adaptations, skilled nursing, transportation, specialized medical equipment, supplies, chore services. Services that qualify for the Waiver program are these, again, they're listed there. There's the website that you can access all this information that you see here on the slide. So those are the services that qualify. Again, a person has to use a qualifying service. Each regional center contracts directly with DDS to provide services to meet the needs of their DD population. Not all Medicaid waiver qualifying services are offered by all regional centers. So a regional center up in Northern California may offer different services than a regional center in Southern California. Each regional center develops their own purchase of services guidelines, and those guidelines are approved by each regional center's board of directors and approved by DDS. A couple legislative changes. In 2009, we had trailer bill language that mandated that regional generic resources when available. So if there's an agency that can provide a service that the consumer needs that's not the regional center, we're mandated to have the family use that service. The trailer bill language also mandated that certain regional centers reduce their services if a generic resource is available, whether or not the consumer chooses to use the generic resource or not. And these are just, I'm going to go through a couple tables just as in summary, and kind of what the difference is. HCBS waiver and the all regional center consumers. So these are just tables just telling you kind of what the difference is. So everybody has to meet the Lanterman Act definition of developmental disability. Everybody needs to be an active regional center consumer. For waiver people, they need to have Medi-Cal benefits. They need to meet the ICF level of care, as I talked about. They can only be on one waiver, so they can't be on another waiver. And the eligibility determination and annual recertification is reviewed by a QMRP, somebody who's qualified. The IPP, the individual program plans. IPPs for both regional center and HCBS participants are responsive to consumers' needs and preferences, and they're developed by a planning team, and they specify the type and amount and provider of services and supports. The difference in the Medicaid waiver program is the IPPs must contain at least one HCBS waiver funded service. Again, this is about funding, so it has to qualify for the HCBS waiver the service does. And under the waiver, the IPPs must be reviewed on an annual basis. And under both, if somebody is just a regional center consumer and if they're on the waiver, they have a right to a fair hearing. If they disagree with that determination or a decision, and qualified providers have all the same requirements under both people who are just regional center consumers and those on the waiver. And just once again, the safeguards to protect health and welfare are the same if you're on the waiver or not for the regional center. Again, necessary safeguards for health and welfare are the same under the waiver as they are for all regional center consumers. And just as a caveat, the Medicaid waiver, as I said, the Medicaid waiver program in other states may be administered differently. One of the main differences between California and its administration of the Medicaid waiver and other states is California has the Lanterman Act, which entitles people with developmental disabilities to services to meet their needs. Other states may not have that requirement, so they may use the waiver money to meet needs. So if they have, say, 80,000 Medicaid waiver slots for that state, they can serve 80,000 people. We don't have that limitation here in California because of the Lanterman Act. I've given you a lot of information, so I'm going to let it sink in and see if there's any questions.
Okay, thanks, Randy. We do have some questions that have come in. Julie has a question. I'm going to go ahead and unmute her and see if she can ask it personally. Julie, are you there?
Yes.
Hi.
Hi, Julie.
Hi. Much. Enjoyed the presentation. We serve families who have children birth to 3, so a little bit of it was us trying to figure out where we fit in, or where the families that we serve fit in down in San Diego.
Uh-huh.
So I think one of my questions, I typed them in. Let me see if maybe I can get them to come back. One was, how does all this apply to children birth to 3?
Well, again, birth to 3.
Does that make it not active? You were saying they had to be an active regional center, but we've had families who have had the home and community-based waiver before.
And they haven't been active with the regional center?
Yes, they were active with regional center in early start. So an early start family can be under the waiver. Is that correct?
No, that's not correct.
Oh.
They need to be determined eligible for the regional center.
Right. So they've taken families who have children they expect will be lifetime users of regional center. Perhaps that's how they qualify them. I don't know, but we have had families who have had the waiver before age 3.
Okay, well that must be rare.
In particular, it would be a child. It would be rare, yes.
I didn't. Well, here's a good example. A child with Down syndrome. It's kind of difficult to determine where they're going to be in 5, 10, 20 years, or what level of care they're going to be. Because as you know, there are people of all varying levels with Down syndrome.
Right.
But they are made active.
Yes, they are made active.
Okay, so that would be why they were able
Yes.
to be on the home and community-based waiver.
Right.
So can a child use institutional deeming to get Medi-Cal without that being in preparation for the home and community-based waiver?
One of the qualifications, and that's the next topic that Suzanne's going to talk about, is the institutional deeming Medi-Cal.
Okay.
But the reason why I went first to explain the Medicaid waiver is that a child needs to qualify for and stay on the Medicaid waiver to keep institutional deeming.
Okay.
So they're linked.
They're linked.
Yes, you
Thought
need.
they were, but when you
yeah.
said that children that had to be active for the regional center, and they needed to be, I mean, they didn't really say over 3, but it kind of implied that. Okay, understand that. I think we all get that. And then we had asked about a website that went by, and none of us got it written down. What was that website for?
The website was just what services are provided through the DDS waiver program.
Right, we were trying to write down that website. Can you give that to us?
Well, I think the whole presentation will be.
Yeah,
Tara's going to post it.
Exactly.
Okay.
We'll be sending it out, so you'll have it, Julie.
Okay, great.
Okay, great. Thank you. So we've got a bunch of other questions. Let me see. One from Joan Crook. Joan asks, can you explain a little more about the $1,000 per month minimum?
Well, again, the $1,000 a month minimum is just a guideline that we've been given by DDS, and again, it's based on funding. If you remember what I said, the whole purpose of the Medicaid Waiver program is to draw down federal funding, and if we're spending $1,000 a month or less on somebody, that means that we're getting from the federal government $500 or less a month, and we may have some people that we're spending a lot more on. The federal government gives the state only a limited number of slots, of Medicaid waiver slots, and those are divvied up by the regional center. So we need to put in the right people on the waiver as far as the funding goes. So that's why they give us the $1,000 guideline, because we need to put the people that we're spending the most on the waiver before we start putting the people that we put the least on. The only caveat to that guideline is children who require institutional deeming, Medi-Cal.
Okay, great. Let's see, maybe we'll take one more question for right now. One is from Alex. Alex says, I have 2 questions. One is an example, what is an example of limited adaptive functioning? That's the first question. And must a child who is otherwise eligible be deemed for an institution to receive benefits, or can the child live at home and receive services if the child has a designated caretaker?
Can I jump in? The child must live at home. We want to provide services in the community. So the Medicaid waiver, one of the purposes is to provide services to individuals who have chosen to remain in the community or in the home rather than be placed in a Medi-Cal funded institution. That should answer the second question. The first question, limited adaptive, is that the question?
Yeah, that was the question.
Individuals who may have deficits in personal care or in bathing, eating, dressing, being able to administer their own medications, being able to manage their medical needs, those would be the limited adaptive. Behavioral support services, communication skills, those are all adaptive skills.
Okay, great. So why don't we, I'm going to keep all the other questions for now, but in the interest of time and having you guys move along, why don't you go ahead and do that, and then we can come back to some of them if we have time.
Perfect.
Okay.
Okay, so I'm going to talk briefly about institutional deeming Medi-Cal. One of the biggest concerns that I hear from families is, if I apply for institutional deeming Medi-Cal, does that mean that I will have to place my child in an institution? The answer is absolutely not. The purpose of institutional deeming was to allow families to access the same type of medical supports and services that their child would receive if the child were in an institution, but to allow them to remain at home. The second big piece of that is that families who may be over the income or the property or the asset guidelines for regular Medi-Cal, because Medi-Cal is a welfare benefit, the child could qualify under their own income, property, or assets. So that's kind of a definition of institutional deeming. Who's eligible? Individuals who meet the criteria of the Home and Community-Based Services Waiver Program. So Randy talked about those 6 criteria. The child who is applying for institutional deeming Medi-Cal must meet the criteria for those 6 waiver program guidelines. The only difference is for the Medi-Cal, we don't typically add a child to the Medicaid Waiver Program until we've been notified by the Medi-Cal office that the child does have Medi-Cal. So in this instance, the requirement for Medi-Cal is deferred pending the Medi-Cal application. The second one is that the child must be a citizen of the United States or in the United States with satisfactory immigration status. So the child can be here with a green card, and they need to have a social security number. The third thing is that the child needs to have an income less than $620 a month. What Medi-Cal often does is they waive the first $20 of any income. And then if it's more than $600, they call that the maintenance needs level, then anything over the $620 is typically assessed as share of cost. There are other programs that Medi-Cal can evaluate the child under, but that's typically the way that they look at that. And also the child has to have less than assets that total less than $2,000. The third thing is the child must live in the family home, and an individual can be on this program up to the age of 21. The typical question I get is, what about between 18 and 21? The most common reason that an individual might apply for institutional deeming Medi-Cal after the age of 18 is that the individual is still here on the green card status and can't apply for SSI or one of the other cash benefits, but they do still need the medical insurance. And so the institutional deeming program allows that individual to continue to receive Medi-Cal up to the age of 21. The Medi-Cal office does look at trusts, and they do look at child support. So the child may be denied Medi-Cal or may have a share of cost if that child has a trust fund or a child support, depending on how those things are worded by the court. How does an individual obtain Medi-Cal? The service coordinator is the one who starts the process. They confirm that the consumer meets the eligibility criteria to be added to the waiver. Then the regional center sends a form called the DDS waiver referral to the Medi-Cal office. The Medi-Cal office then assigns a worker to the child's case, and the family works directly with the Medi-Cal office to complete that application. The family is responsible to submit all of the paperwork that the Medi-Cal office needs to that Medi-Cal worker so that that Medi-Cal worker can review that family and that child's eligibility for Medi-Cal. One of the misconceptions is that if a family is applying for the institutional deeming Medi-Cal program, that the family doesn't have to submit any of their own personal information. Because Medi-Cal is a welfare benefit, the family needs to be found ineligible first before the child then is reviewed for their own eligibility under the institutional deeming Medi-Cal program. Once the application is completed, the family has submitted all of the paperwork, then the eligibility determination is made by the Medi-Cal worker and the family is sent a notice of action. If the family is eligible for regular Medi-Cal, the child will be added to the regular Medi-Cal program and not institutional deeming because their family is income eligible. They qualify for the welfare benefit. If the child is found eligible for our program, they will receive a notification that says the child is eligible for the Medi-Cal through the DDS waiver program. And if the application is not completed, the family will receive a Medi-Cal denial based upon the fact that the family did not submit the verifications that the Medi-Cal office asked for. One of the questions that I also get often asked is, what are the advantages of having institutional deeming Medi-Cal? For the regional center, One of the big advantages is if the family is using a service that is assessed FCPP. One of the big ones is parent-rendered respite or agency respite. Then it will waive the FCPP assessment that the regional center is required to make for those services. So then the family might be able to receive all of the respite services because of the hours. Let me back up a minute. The respite hours that they were determined to be eligible for, because they have Medi-Cal, they can waive the assessment. The second one is that Medi-Cal offers a number of services and supports that may not be covered by private insurance. I've listed some of the more common ones. EPSET benefits are a Medi-Cal funded service. Shift nursing is one of the biggest ones that families are interested in accessing. And then the third thing is Medi-Cal serves as a secondary. So Medi-Cal may cover certain co-pays once the private insurance is paid, most commonly medications at the pharmacy, hospitalizations, and durable medical equipment. And then the other question that I'm often asked is what causes the institutional Medi-Cal case to close or to be denied in the first place? If the Medi-Cal application, if it's not responded to by the family in a timely manner sent directly to the Medi-Cal office, the Medi-Cal office has no choice but to deny the Medi-Cal. The second one that we have seen is sometimes the family or the child has unsatisfactory immigration status. So if the child does not have a social security number or does not have a green card or is not a citizen, that case would be denied under this program. The third thing is the child might have excess income, they may have assets over $2,000, or they may have property that disqualifies them for the Medi-Cal program. Once Medi-Cal is approved, some of the reasons that the Medi-Cal then case closes a year later is that the family moved and maybe didn't notify the Medi-Cal office of their forwarding address. Therefore, when the Medi-Cal office went to send them out the annual redetermination paperwork, because Medi-Cal is required to review eligibility each and every year, they didn't have a way to get a hold of the family, so it came back as the family didn't respond. One of the other misconceptions is once the family has Medi-Cal under institutional deeming, the family may think that they are able to just keep Medi-Cal without doing anything further. That is not accurate. They need to continue to remain eligible for Medi-Cal directly with the Medi-Cal office, or the child becomes eligible for regular Medi-Cal. Either the child becomes eligible for SSI, and so the Medi-Cal is administered through that program, or the family income changes and they become eligible for regular Medi-Cal. One of the other things is that institutional deeming Medi-Cal is a California program. If the child leaves the state of California, then the child is no longer residing in California, and that may close the Medi-Cal case. Or the child is no longer eligible for the waiver program. We do have circumstances where the family may not have billed service once a year. We have other cases where the child may not have the required 2 CEDAR deficits, and so we cannot continue to allow, they do not continue to qualify for the waiver program, therefore they cannot be eligible under the institutional deeming Medi-Cal program any longer. Are there any questions?
Okay, so if folks have questions on this section, go ahead and raise your hand. There's one from Denny. Let me see if we can unmute him or not. Denny, are you there? Yeah, we may not be able to. Okay, so I'll read Denny's question. He says, my son is 2 years old with a diagnosis of CP with severe developmental delay. Currently a regional center consumer. I was told that we can't apply for the institutional deeming, and they've only done institutional deeming for Down syndrome under age 3. Are we eligible or not?
The regional center that is servicing this individual would need to determine whether this child has a developmental delay. that will remain at the age of 3 into a developmental disability. So that would be a discussion with the regional center that is carrying this case. So the 2-year-old child would not be eligible to apply for institutional deeming Medi-Cal until the child were determined eligible for ongoing regional center services and be made active.
Okay, great. Let's see. So other folks, welcome to raise your hand. Let me look at my list of questions here. A number of folks asked actually how long it takes to process the application. Sounds like some people wait varying amount of times to get the waiver approved. Do you have a sense?
Are you talking about institutional deeming Medi-Cal?
Yeah, I have both questions about how long it takes to apply until you get services.
Well, I'll answer the institutional deeming one.
Okay.
Once the regional center sends the DDS waiver referral to the Medi-Cal office, it is out of the regional center's hands. At that point, the Medi-Cal office is the one that needs to make the assignment and send the referral and work directly with the family to get that Medi-Cal application completed. So the families sometimes think that they're waiting for the regional centers, but once that referral is mailed from our office or sent out of our office, our piece of it really is done until the final determination is made. I can only speak for Orange County, but I am aware that sometimes in Orange County it can take 5-6 weeks for the family to be assigned to a Medi-Cal worker and for that worker to make the initial contact with the family. If the family does have all their paperwork ready to submit, the Medi-Cal application at that point can go very quickly. But it can take sometimes up to 3 months to finalize the entire process. The Medi-Cal, though, does go retroactive to the month that the application was made.
Okay, great. We have a question from Nina. Let me see if I can unmute Nina. Nina, are you there? Okay, I don't hear. She says, my son is institutionally deemed now, but will be turning 21 in 6 months. What happens to his Medi-Cal coverage? He has developmental disabilities and cerebral palsy.
The family would need to apply for Medi-Cal directly with the Medi-Cal office. Her son would need to be determined to be developmentally, actually to be determined disabled using the Social Security eligibility criteria. Medi-Cal uses the exact same disability criteria as Social Security does. So that determination would need to be made by the Medi-Cal office. The Medi-Cal office may ask the individual to go apply for Social Security unless there is an immigration issue, at which point they would apply directly for the Medi-Cal. And then the Medi-Cal office would send the case to their Disability Determination Services Center for review.
And for cases for people that are over 21 or have turned 21 or actually have turned 18, we encourage the family to at least apply for SSI, because then the consumer would also get some SSI funds in addition to SSI-linked Medi-Cal.
Okay, great. We have a question from Joan. Let me see if I can get you unmuted, Joan. Joan, are you there?
Hello.
Hi, Joan. Yeah.
Hi, Sarah. We were wondering how this information on the waivers gets down to the level of the caseworkers so that they know the eligibility criteria and services offered. And are they the ones that, they're the ones that get the consumers into the program at that point, right?
Are you referring to the Medicaid Waiver program or for everything?
Actually.
Or institutional deeming.
Well,
it falls on the regional centers.
for the regional center, they come out one time a year and do an individual program plan, and they identify some needs. and if the needs are meet the criteria for the federal guidelines for the Medicaid Waiver program, they can put that child on the Medicaid Waiver program, and then the institutional deeming application can occur.
But who trains the caseworkers?
Well, here at Orange County, I'm the one that trains them on the Medicaid Waiver, and Suzanne's the one that trains them on institutional deeming. Each regional center, I think, has their own training mechanism.
Oh, okay.
We're all kind of different because we're all not-for-profit, so.
You know, we do have another question, too. That the regional centers can decide what services to offer, even though this is a federal program that has a full list of services. I guess the question kind of is, how do the regional centers get away with not offering everything, all the services that are in the federal program?
Well, once again, as I spoke about before, California contracts with the federal government. And they have a list of services that they will provide. So California's list of services may be different than it's the same one. I'm sorry. Oh. Well, what I'm saying is, on the, if you go back to the list, it was pulled off of the California list. So all of the services that you see are on the California list.
And the question was, how does the regional centers determine which services to offer or not?
Right, and once again, the regional center contracts with DDS, and it's based upon each regional center's Board of Directors determination of the purchase of service guidelines. So the regional center comes up with
to offer a smaller number of services than the federal government says.
No.
No. Okay. All right. Thank you.
Thank you.
Okay, thanks, Joan. Let's see who else we have. I have a few hands. Let me see if I can unmute folks. Rosa, I'm going to try to unmute you. Rosa, are you there?
Yes, I am.
Hi, Rosa.
Hi. My question is, I might have missed it because I'm taking care of my son at the same time. Do parents have to submit their financial status when they're applying for this medical waiver program?
Are you talking about for institutional deeming or just
Yes.
for the Medicaid waiver?
For the Medicare, I thought they were the same thing. I'm sorry, the Medicare
Yeah,
waiver.
well, for Medicaid waiver, it's based on what the regional center is paying out or funding for the consumer. For institutional deeming, it's based on the family income and the child's income.
So you provide financial information directly to the Medi-Cal office when you're applying for institutional deeming Medi-Cal. And the reason for that is that Medi-Cal is a welfare benefit, and so the Medi-Cal workers are required to rule out a family's eligibility for regular Medi-Cal before they can consider the child eligible under the institutional deeming program.
Oh, okay. So first they have to submit it to be denied, and then after they're denied, the children are qualified for the deeming.
Yes.
Okay. Thank you.
Okay, thanks, Rosa. Let's see. We have a question from Denny. Denny says, if the child has his private insurance from his dad, can he use Medi-Cal for the services such as speech and occupational therapy?
That's a very good question. And it depends on what services are provided through the private insurance. If the private insurance offers certain therapy services, the family must access the private insurance first. If they've maximized the private insurance and they get a statement from the private insurance that the therapies have been utilized and there's no maxed out for the year, then they can take that statement to the Medi-Cal doctors and make that request. But they can't use Medi-Cal as the first insurance and skip the private insurance.
Okay, gotcha. We have a question from Leslie. Leslie, I'm going to try to unmute you. Let's see if you're there. Leslie, you there? No, okay. Then I'm going to read her question out. She says, my son is institutionally deemed, but because we have private insurance as a primary insurance, I'm wondering how we will know if we can remain on the medical program if they are not necessarily billed for any service within a year's period of time.
The billing requirement is not to be accessing Medi-Cal. The family just needs to have an active Medi-Cal case. What the billing requirement is that the family utilize the regional center service that regional centers are paying for. So that could be parent-vended respite, it could be agency respite, it could be whatever the service is that is qualifying the child for Medicaid waiver. That's the service that needs to be billed to the regional center at least once a year to keep Medi-Cal. So they don't actually have to use Medi-Cal at all if they want it just as a secondary insurance and kind of like an insurance security policy.
Okay, great. And let me just check, is this your last slide, guys? Do you still have time to answer questions? Okay, okay. Let's see, here's another one. From Denny says, when early start families have questions about institutional deeming for Medicaid waiver and would like to speak with someone about a service coordinator and ES managers, who might be the appropriate person to contact within the regional center?
That would really depend on the regional center. I can't give you a good answer for how the other 20 regional centers would do that.
Here in Orange County, our point of contact is the service coordinator. So the family has a relationship with the service coordinator and would ask questions or raise issues or do whatever they need to at the annual review or whenever they wanted to call. And if the service coordinator didn't know the answer, they would take it to the next level.
Their supervisor.
That's the way it works here in Orange County. Again, we can't speak for the other 20 regional centers.
Okay. Fada, let's see if we can unmute you. Fada, you there? No, okay. She says, my son has been on the waiver since he was 2. He has severe autism, and every year we have to reapply for benefits. Many of the Medi-Cal workers don't know how to process the application. Also, the IHSS workers don't seem to be knowledgeable about this program. I feel like I have to explain it to them.
Actually, yeah. all points raised are true. The Medi-Cal offices are required to review eligibility for Medi-Cal every year. I understand from the Medi-Cal workers, at least in Orange County, that they are trying to go to a generalist system. So where there have been Medi-Cal workers that specialized in institutional deeming Medi-Cal, you're going to find that more and more workers won't know anything about the program because it's such a tiny portion of their population. So that is true that there may be some that don't know very much about institutional deeming and that they may have to explain it. The good thing, though, is that the Medi-Cal workers always have a supervisor or a supervisor's supervisor, and so you can always work your way up the chain. The third point that you made was about IHSS. the important thing with IHSS is the aid code. So as long as an individual has Medi-Cal that has determined them disabled, that individual ought to be able to access IHSS services without any glitches.
Okay, great. Let me see if there are other questions. We've answered a bunch of these. This is a little bit related to IHSS. Audrey says, how do the services offered under the waiver interact with the same or comparable services covered by Medi-Cal and or IHSS?
IHSS would fall under that trailer bill language that we talked about. If a child is eligible, or if a consumer, because Medicaid waiver is for all ages, if an individual is eligible for IHSS services, those services need to be accessed first before Regional Center funds any additional services that are comparable. Did I answer the question?
I think so. If not, they'll let us know. Carolyn asks, can a child under the age of 3 who has a diagnosis of spastic quadriplegia cerebral palsy qualify for institutional deeming?
Only if the regional center has made that child active and has determined that he or she has a developmental disability.
All right. When we get the Medicaid waiver, do we have to do paperwork to renew for service, or once we have it, will it last for a long time?
Once you're on the Medicaid waiver program, you're just on it until you choose to get off it. Like I spoke about in my presentation, the Medicaid waiver program is voluntary. So you sign a form to participate, and you also sign a form to be taken off the Medicaid waiver. The only caveat is, and as I discussed, the child or the individual needs to qualify for the waiver, meaning that they have to have certain deficits and use the service one time a year.
Okay, great. And let's see, in the interest of time, we might want to start wrapping up. But one question from a member is that some of the members are broadcasting the webinar today to a number of people in their offices, to families who are coming to watch today. And one asks, if someone in the audience here has questions afterwards, is there a way to communicate with you guys to get the answers after today's presentation?
What I would suggest, because again, we're 21 regional centers, and we kind of have different procedures. It's the same program, but each regional center has different procedures. So I think the best answer would be to ask your individual service coordinator or regional center from here going forward what they do. And I would direct the question to your service coordinator or your regional center.
Okay, great. Do you guys have anything else to add today?
I do, if that's all right.
Yes, please.
One of the things that's, I guess, confusing to our own service coordinators, and so if it's confusing to our service coordinators, I know it can be confusing to our families, is that the Medicaid waiver program is different than institutional deeming Medi-Cal. The Medicaid waiver program is administered by the regional centers, and the purpose is to bring in federal dollars. But an individual must be on the Medicaid waiver to receive institutional deeming Medi-Cal, and the individual receiving institutional deeming Medi-Cal must keep Medi-Cal in order to stay on the waiver. So there's a correlation, but they are not the same program, and I know that's sometimes really confusing. So if an individual loses Medi-Cal, regional centers will take the individual off the waiver program. Or if the individual loses Medicaid waiver eligibility and they have institutional deeming Medi-Cal, they'll take them off the waiver program and notify the Medi-Cal office that the child is no longer eligible for institutional deeming Medi-Cal because it's administered through our waiver.
Great, thank you. It is confusing. It's confusing to all of us. So then your best recommendations for if people are still confused is to contact their local regional center?
Correct.
Okay.
And if the service coordinators really don't know the answers, then their supervisors or maybe they've designated someone in the agency to answer the questions about Medicaid waiver or institutional deeming Medi-Cal.
Okay, great. Well, thank you guys so much for being here. This is a lot of information, but it's really great information. We had a really interesting mix of folks on the call, and thanks for taking so many questions and being available for that. So as a follow-up to today's call, everybody will receive a survey by email, so please take the time to complete it. It helps us keep this program going and responsive to your needs. And if you have any follow-up questions, let me know. And you can check our website at familyvoicesofca.org. We will have a webinar coming up next month on the first Wednesday, September 1st at 12, on healthcare connections with Juno Duenas and Mara McGrath. And I'll send that out also as a notification. And please just stay tuned for more information on speakers. Randy and Suzanne, thanks so much for joining us.
Well,
You're welcome. Thank you.
Thank you to everybody. Goodbye.